So I've been asked to talk about your risk of COVID-19 if you have atrial fibrillation. And the answer is it depends. So if you're younger than 65, if atrial fibrillation is a sole condition in you without any other cardiovascular risk, it is thought that you don't have any higher risk of catching COVID-19 or developing a complication from COVID-19. Now, if atrial fibrillation does coexist with other conditions, and this could include things like hypertension, diabetes, ischemic heart disease, heart failure, renal failure, or chronic obstructive airways disease, then you would be at a high risk of COVID-19, but not specifically from the atrial fibrillation itself. Now, what should you do if you're taking drugs to treat atrial fibrillation? The answer is you should continue all drugs, especially the anticoagulation, if this has been prescribed by your doctor. So please continue to take both the anticoagulation as well as the antiarrhythmic drugs, things such as beta blockers or calcium blockers that you may have been prescribed, as these will continue to keep your heart rates under control. It's important to say that at this time, if you're in a high-risk category, and that's not atrial fibrillation itself, but atrial fibrillation with another condition, then you should follow the local advice to self-isolate to prevent the risk of you becoming unwell with COVID-19.